Buongiorno, è un piacere stare qui con voi. La mia presentazione sarà in inglese e dopo, se ci sono delle domande o qualcosa che non è stato chiaro, possiamo parlare anche in italiano. First, I will talk about vulvar lichen sclerosis. Can Heterologous type 1 collagen treat vulvar lichen sclerosis? I will present a female patient, 36 years old, with a biopsy-proven vulvar lichen sclerosis. First, I will say a few things about this disease. It's a chronic inflammatory dermatosis characterized by ivory white plaques or patches with glistening surface commonly affecting the anogenital region. It may cause substantial discomfort due to the intractable itching and soreness, while thinning and shrinkage of the genital area make coitus, urination, and defecation painful. Advanced disease has on one hand a considerable impact on the quality of life, and on the other hand, it's associated with an increased risk of vulvar squamous cell carcinoma. Is there a definite cure for this disease? The answer is no. There is no definite cure for this disease, and nor is there a comprehensive treatment to cover all patients. So, current guidelines aim to treat patients with ultra-potent topical corticosteroids. Let's go back to our patient. She suffered from porcelain white atrophic confluent plaques with fragile surface associated with pruritus, soreness, discomfort, erosions, and dyspareunia. She used an ultrapotent topical corticosteroid, clobetazole propionate, twice daily for 3 weeks, and after the 3 weeks she had a slight clinical improvement, there were no erosions, and a minor symptomatic relief, a bit less pruritus. At that point, I had in front of me a young patient who was desperate because her life had changed from minor things, she couldn't put on tight pants, and to more important things, the relationship with her husband had changed. So I suggested, and she agreed, to try an innovative regenerative treatment with Heterologous type 1 collagen injections. Heterologous type 1 collagen is being used for the last 30 years in dermatology, angiology, vascular surgery to treat open wounds, scars, bed sores, in the form of a lyophilized collagen patch which was being applied directly on the lesion. Lately, for several years now, a powder formulation with the same active ingredient is being used widely in cosmetic medicine for anti-aging treatment, as it produces optimal conditions to restore connective tissue. How does this work? In order to get the powder injected, we dissolve it in normal saline. Once dissolved, it is hydrolyzed in tripeptides and amino acids. Tripeptides, on one hand, act as dermal growth factors to the old fibroblast. We have cellular mitotic activity, and we have production of young fibroblasts. The amino acids are being used by the young fibroblasts to produce collagen type 3. And on the other hand, the tripeptides block the action of metalloproteinase. So now, what did we do to our patient? 100 milligrams Heterologous type 1 collagen powder dissolved in 4.5 ml normal saline plus 0.5 ml lidocaine was injected to the affected area. We injected 0.1 ml per point intradermal or directly subdermal at approximately 1 centimeter intervals. We used the 32G needle, 4 millimeters, and we used the topical anesthetic cream before the injections. Let's see now how we started. This is before the first treatment. We did four treatments, once every 15 days. This is before the second treatment. We already see the improvement. This is before the third treatment and before the fourth treatment, where the lesions practically disappear. At a quick overview, when the patient came for the second treatment, she was really happy and she reported that she was free of symptoms and she stopped using the corticosteroid cream. And she hasn't used it since. There were no side effects and she reported minimal to moderate pain. Now, after 3 months, she came for the maintenance treatment because it's a chronic disease. All this period, she was fine and she didn't use any cream. 2 months after, she came for the second maintenance treatment. As you see, she's really fine. And 7 months after the fourth session, she's really happy that her life came back to normal and she tried this technique. Now, one more thing, which is one more case, is the mother of the patient who was suffering from the same disease and she was using a topical corticosteroid cream. And she was coming with her daughter and she was saying, these injections are for young women, I'm fine with my cream. But at a point, her lesions started to expand, they started getting worse, so she forced in a way to try the technique. This is how we started. This is 15 days after when she came for the second treatment, and you already see the improvement. And this is where she came for the third treatment. The lesions practically disappeared. Of course, her opinion about the age range that the injections are being performed is changed dramatically. So, Eterologo type 1 collagen is a successful treatment option for vulvar lichen sclerosus. It has excellent results, it's safe, has no side effects, can be performed in any office setting under local anesthesia, and it can be combined with any other treatment, or it cannot be combined and used as a monotherapy. Now, you can imagine if collagen can treat vulvar lichen sclerosus with good results, how remarkable the results will be if we use it for rejuvenation of the genital area. Here is a suggested protocol. We use again 100 milligrams Eterologo type 1 collagen in 4.5 ml normal saline and 0.5 ml lidocaine. We do 4 treatments 2 weeks apart, and we can do a maintenance treatment once every 2 months. And we inject 2.5 ml per vulvar site. Now, given the fact that Eterologo type 1 collagen is successfully being used in several medical fields, and given the results obtained with Eterologo type 1 collagen not only in vulvar lichen sclerosus but also in rejuvenation of the genital area, we can consider Eterologo type 1 collagen the first choice treatment for skin regeneration. Now, la medicina estetica valorizza la bellezza. E la bellezza comincia sempre con un sorriso, un viso sorridente è sempre un viso bello. E vi posso dire che i miei pazienti con collagene eterologo di tipo 1 hanno un sorriso enorme. Grazie.
Grazie mille dottoressa, è molto interessante. Non so se la collega ginecologa conferma, io come dermatologa spesso vedo pazienti con lichen scleroafrofico